All right, next one.
Difference between under and over muscle?
Yes, and so when we're talking about breast augmentation, implant position is a part of the consideration. Now, that has been a very long technical evolution about where implants go, and it's also evolved over time, and some people are now kind of going back above the muscle. But originally, implants were placed above the pectoralis muscle because it was an easy place to put implants, and the concept was you need more volume, let's just put it under the breast tissue over the muscle. One of the complications from breast augmentation surgery is capsular contracture, scar tissue that forms around the implant. And what was discovered is if you actually work a little tiny bit harder and put the implant underneath the muscle, you have a much, much, much lower chance of getting that scar tissue, getting capsular contracture. And so that kind of really became the standard of care. Now there's some thought about maybe going over the muscle makes more sense, maybe putting some mesh or acellular dermis around the implant while you're doing it. The new generation of implants tend to have less silicone bleed, which may have been associated with capsular contracture. It's complicated, and we could spend hours talking about it. The most important thing is when you find your plastic surgeon, ask them why they place their implants where they do and what the benefits and risks are, because in each individual surgeon's hands, they're using the techniques that work best for their patient. Thank you for the questions. We're going to do a couple more. I said it was 3 before, but it was really only 2. We're going to do 2 more in the next one. Thanks, guys.